Assalamu alaikum. We have the same case that we have recorded earlier for. This was the case where we had problems with the fitting surface with overextensions, and the rugi area was an area of pressure points. So we removed it. We also had this area where it was a sulcus or a place where a socket of extraction, this one here. And it was bulging into the fitting surface of the denture, okay? And asked the student to remove it because it will always keep the socket as if it's not healed. So what we did, we removed the step that's here. There's still something, a little bit step here. Please remove it, okay? What does the patient put? Does he use adhesives?
Yes.
Okay, try to just remove this. Now, the second adjustment was this. We got this morphology. So he removed the high spots. So we had better adaptation, okay? But the point was that, see how thin it is now? So better adaptation. Once more, we also had on the crest of the ridge. We said one of the reasons why crest of the ridge sometimes have a heavy spot on the fitting surface comes from the occlusion. So this is the occlusion of the patient. When I take the occlusion, usually I ask the students to put them all together. So what do you see? Is the occlusion distributed on all posterior teeth? This is only centric occlusion.
Yes, it is distributed on all posteriors, but with
Yes.
heavy contacts on one side rather
There
than
is
the
heavier
other.
contacts
Yes.
on one side. Okay, so that one side is the same as this side. Okay, if I put this here, there are heavier dots on this side, so they might be causing some of the occlusal pain. Are they distributed up to the 7? Yes. Does the anterior teeth take any bite?
No.
Here we know we do have. You see the
yes,
bite?
yes, yes.
This is not an area of pressure that should be allowed in centric occlusion. The anterior should be clear of all contacts. So please remove these anterior contacts altogether. Remove them altogether. Remove this heavy spot and remove this heavy spot, okay? This will distribute the bite even better, not having heavy pressure on the points. Now we're going to repeat the occlusion once more in eccentric. Because sometimes the centric occlusion is okay, but it's the eccentric that's not. So what are you going to do? After removing these heavy spots and removing all contacts from the anterior, we're going to let the patient bite laterally as if he's biting on food. Okay? So we're going to do protrusion, lateral excursion, and another lateral excursion. We're going to check for non-functional cusps. So the functional cusps here, we equalize them by removing this heavy spot. These functional cusps, we equalize them by removing this heavy spot. Anterior teeth, we relieve them from all pressure by removing everything.
Yes.
Now, we're going at the eccentric, we're going to look at non-functional cusps in the upper end. Okay, look at the upper functional cusps. Once more, we have a heavy spot here. We're going to relieve it from the lower. And by the way, do we relieve from the upper or the lower? Can you guess?
We can do both, right?
No. Usually, you put this on the plate. And we see the relations of teeth on the plate. If this was correct, all of the adjustments are done in the lower. If one of the teeth are high and it's rocking on the plate, we will remove from the upper. Okay? So we equalize the upper first to the plate. Do you remember?
Yes.
Or the mirror or a glass slab.
Yes.
And then we work the rest on the lower. Okay. Now, also once more here, the functional cusps are taking bite, but this is a bit heavy. So we're going to remove it from the lower. Okay? Anterior teeth should not have a bite. We're going to remove them from the lower. Now, when you do eccentric, we'll record another video to show the eccentric. And then you also removed some of the borders, صح?
Yes.
There were some overextensions in the border. We removed them. We opened the freni. We've discovered the frenum was not relieved. And what else did we do? Occlusal adjustments. After all of this, we're going to repeat the rubber and see what happens. Okay? So stay tuned till we record the second video or the last video.